Here we are, a new year, fresh start, and major goal setting mode. I always start my day with coffee, and this time of year, you can step up your game by adding a protein boost to your favorite Dutch Bros coffee drink with their new protein milk. Dutch Bros coffee also has a new salted caramel protein coffee, and you can order it as a latte or a mocha, and that's available for a limited time now through February 29th. So if you're in the phase of wanting to work out more and adding workouts to your routine and just kind of getting back on track, this might be a great fit for you. Visit DutchBrosCoffee.com for full nutrition details and follow at Dutch Bros Fresno on Instagram for all the fun. So I recently discovered the yummy flavors and healthful benefits of squeezed juice, and I am hooked. As a mom, I know the daily dance with school germs all too well. That's why I've made squeezed juice a staple in my home. Not only do these premium refrigerated juices taste absolutely delicious, but they also support my immune system with 100% natural ingredients. No added water or artificial concentrates here. Picture this: pomegranates and mandarins grown by dedicated California family farmers, hand-picked and pressed into every bottle. That's a tree to bottle promise. But squeezed juice doesn't stop there. Their functional juices pack a punch, whether it's the green-powered energy, the immune-boosting immunity, which is one of my favorites, or the focused clarity of focus juice. They keep me going through those busy work days. And I've been told that one of their 11-ounce bottles is equal to 1.5 cups of coffee. So I've actually been trying to replace my afternoon coffee pick-me-up with one of their juices, and it is divine. You can order your own stash of yummy energy and vitamins by visiting shop.squeezedjuice.com and following them on Instagram at @thesqueezedjuice. Coffee Monday is more than a podcast. It's a movement to reshape the way we approach Mondays and the week ahead. It's about embracing the reality that work doesn't have to dominate our lives. It's about finding that sweet spot where passion, purpose, and a cup of motivation connect. Filmed and recorded in California's Central Valley, join me, your host, Ray Pardini Matson, as I invite thriving professionals to share their stories of how they're crafting a life that's both vibrant and balanced. Well, I feel like I have so many things I want to talk to you about, so I think we're just going to dive in.
Okay.
Dr. Shantharam, Rohini, thank you so much for being here.
Thank you for having me. I'm so excited and honored to be here.
Oh, thanks. Yeah. Board certified dermatologist.
Yes.
With a focus on cosmetics. So I want to talk about that.
Yeah.
We initially met through our kids, actually.
I know. I love that.
I know. It's fun. Fresno, right?
But, hey, that's the beauty of it though, right? Mm-hmm. You get to see it's like full circle.
Right. So different worlds, right? So the personal side we met, and then I get to know more about you and your profession and all of your accomplishments. And I'm just so impressed by you and grateful for you to be here. And I think for our listeners, I'd love to start with just background of you as a person and kind of your upbringing, how you came to dermatology. So let's touch on that a little bit.
Yeah. So I grew up here in Fresno in the Central Valley, and I had acne growing up. And at that time, so it's over 20 years ago, the treatments were still being studied. It was hard to treat acne, being skin of color, dealing with hyperpigmentation. And I, felt like it really affected my confidence. So I kind of decided in high school that I wanted to be a dermatologist.
That's amazing.
It's not many people do that.
Right.
But I was a total nerd. Very much. I mean, I played, tennis, but I was very much into studying taking the AP classes. I had my hair up in a ponytail, wore a sweatshirt, had a unibrow, all the things. But I kind of committed at that time and then went on with, college and med school.
That's amazing. And your dad is a physician, right?
Yes. Yeah.
Okay.
My dad's a physician here. He just retired a year and a half ago, orthopedic surgeon.
Cool.
Physicians in the family, no dermatologist. So it was new, but definitely had a lot of support. And obviously, Indian parents are very much sticklers on studying, very strict. Education is key. So from the time I was little, it was like very, very heavy on study before you do anything else.
Yeah, well, that's amazing. I mean, clearly it's paid off very well for you. You're extremely studious and very good at what you do.
Thank you.
I'm just impressed. I think back to high school and I feel like, you have your meetings with your counselor of like where you want to go to school and what you want to be when you grow up. And the fact that you knew so early on that that's what you wanted to do, I think is super impressive.
Yeah. And I don't think it happens for everyone, right? So I don't expect that like for my kids, for example.
Right.
But I think you do just, become passionate about something when it affects you in some sort of way, right?
Absolutely.
And so I think that's where it started. And I like shadowed a dermatologist in town in high school. I still have this really old book that's probably falling apart that was like now outdated dermatologic diseases that I like took as a high school student to read so I could like shadow her and not feel like I didn't know anything.
Yeah. Wow.
It was very nerdy. But I was like, I did the science fair. I did all the things. I've always been into science.
Very cool. So when you were thinking about undergrad, like, did that affect, obviously you knew at that point you wanted to be a dermatologist, right? So talk to me about education path and all of that.
Yeah. So, I applied to all of like the UCs and kind of decided, do I want to go broad and just sort of do the undergrad thing? I had found out that there were these guaranteed medical programs that you apply for essentially in high school, which you're applying to undergrad and med school at the same time. And there's probably like, I don't know, maybe 20 in the nation. And so applied to those. They interview you for the med school when you're in high school. But the great caveat is that you don't have to take your MCAT. And so you're already accepted into medical school as a high school student, but you do have to maintain a certain GPA and like fulfill all the credits and all the things. But you don't have to sit for that big exam. And that was huge. So I got into one of those programs.
Oh, amazing.
And that's sort of what dictated where I went. But yeah.
Right. So where'd you end up going?
So I ended up going to to Virginia Commonwealth University, which is in Richmond, and that then fed into the Medical College of Virginia.
Wow. So coming from West Coast, Fresno, California to Richmond, Virginia, I bet that was an adjustment, right?
Huge.
Yeah.
It was huge change. And Richmond's kind of considered the South. So culturally a little bit different. I turned 17 in college. So luckily made like a wonderful group of friends, out of which like my dorm mates are now, one of them's a neurologist, one of them's a psychiatrist, another one's a dentist. So we were all like kind of in it. There was sort of this honors medical program thing there that we did together. Found a wonderful group of friends. I was in a sorority, so I actually kind of let go of some of my nerdiness in college and kind of like blossomed in the other side of life. So, everyone takes their own path, but I mean, I had to be really like focused because you can't get kicked out of the program, which can happen if you kind of veer off too much, but definitely allowed myself to I majored in economics and minored in chemistry. I actually presented at the Federal Reserve for a competition that I did, and I studied abroad. So I got to like put my hand in a few other things. I almost considered not going into medicine for a little bit because I really liked international economics and like game theory. Believe it or not, I don't remember anything about game theory anymore. I don't know if even know what it is, but
well, I was an econ major.
Okay, so I don't know why. Like maybe that's like the math, sciencey side of me.
I could see that connection for sure. Yeah.
But then I kind of like steadfast, you know, I was like, no, I'm medicine all the way.
Yeah.
And
Cool.
then jumped into med school.
Wow. So were you on the younger side when you started med school, since you were on the younger side starting undergrad? Or?
Yeah. I would think there was one girl, another Indian girl in my med school class who was younger than me from what I remember, but I was one of the youngest.
Wow.
Yeah.
And so hunkered down and did the med school thing for how, 4 years?
4 years.
Yeah.
Yeah. Med school was hard. It was really
bet.
hard.
Yeah.
I think because I had been like so focused my whole life from like it's just my personality. I've always been really into studying, wanting to get straight A's. It sounds so nerdy, but
It's amazing.
But at the same time, I kind of had this point in med school where I was like, I feel almost a little burnt out. So med school was hard because I was trying to navigate just like being in my early 20s with having to study rigorously for these tests every 2 weeks, taking boards. And then there's obviously life. Like you're in your 20s, you have boyfriends, you break up with people, you have all the things going on. And so I think trying to learn how to compartmentalize to make sure that like your career doesn't fall apart was probably something that was very hard, but had to be done.
So do you specialize? Like, did you know going into the beginning of med school that you were going to be studying dermatology specifically, or how does that work? Do you?
So actually, no. So everything about becoming a dermatologist is that you have to match into it. And it's really hard to get into.
What does that mean, match into it?
So match, that's a whole thing out of medical school. So when you do medical school for 4 years.
On top of the 4 you did for undergrad.
Yeah, on top of the 4
so you're in school for 8 years, just setting the stage here. That's commitment.
Yeah, so it's a little bit of a drawn out process, but after your first 2 years of med school, you have to sit for this exam called the boards, step 1, where your board score can determine what specialties you can potentially apply for. And some of the harder ones to get into are dermatology, ophthalmology, orthopedic surgery, plastic surgery. They take only a very small cohort of patients, every year through this match, which I'll explain in a second. And so it's a little bit out of your hands, which is that whole ambiguity of where you're going to end up is what makes the whole med school process extremely stressful. So after your first 2 years, you do your clinical rotations, and that's where you get experience in everything. So you're in the trauma bay doing general surgery stuff, you're doing internal medicine, you're in the psych wards, you're doing it all. And you're taking exams every few months for those specific subjects. And then you you start applying for the residency program that you want to get into. So you choose your specialty, whether it's dermatology or orthopedics or plastics or ophtho, whatever it is, internal medicine. And you have to be invited for interviews. So after you get invited for interviews and you fly and you sit for these interviews, you have to create, it's called the match. So you rank the programs that you want to go to, and they rank you.
Oh, wow.
1, 2, 3, 4, 5, all the way down. And I did couples match with my husband. So that was a whole different permutation and 2 hard specialties. So I was told several times that I would never become a dermatologist. It'd be really hard to match. You're doing it with you're trying to apply with your husband who's applying for orthopedics. So there was a lot of stress.
So you guys met in med school. He's an orthopedic surgeon, correct?
Yes.
And so you have to match
together.
His and yours.
Yes.
Wow.
So we had to even consider not being together for the period of our training.
Yeah.
And putting in, in the match system, me matching in, for example, we'll say California. I ended up doing residency in New York, and him matching in New York to be able to get into our fields and not give up the career as a dream, but then sacrificing not being together for 4 and 5 years. So that was also stressful. So I think that was a really tough part of the whole career situation.
I bet. I mean, it's not like 4 or 5 months. It's not even a year. It's like years plural.
Years. And with busy schedules where it's hard
right.
to fly and like see each other.
So you got matched together.
We did not, I did not match my first time, full disclosure. So we made it such that if I didn't match, but I could get my intern, so I had to apply for my intern year also. So I do 1 year of just medicine, internal medicine, where you're in the wards, in the hospital, call, all those things. And then you do your 3 years of dermatology. So I had to make it so that if I could at least match in my intern year,
smart.
and then do research in New York or a big city that had multiple hospital and health systems. And if he did the same, then we could figure it out. And that's actually what ended up happening.
Amazing.
I matched into my intern year, didn't match into dermatology. My husband matched into orthopedics in New York. And then I luckily got into a research fellowship at Mount Sinai, St. Luke's, to do a research year. But then a program opened up and they took 3 people and I ended up getting in. So
Amazing.
I got lucky there.
Amazing. So you worked your, what off. That's awesome.
So we really just, again, I tried not to let obviously our career fully take over our personal life. And we really did want to be together through that time because, we essentially finished after med school, we got married and that was going to be 4, 5, 6 long years. His program was 5 years and then he did fellowship. And so it's, we've been through it all together.
Yeah. So. And then you taught together, right? Or did you teach while he was?
Yeah, I got to, so I think the world just works in such interesting ways. I was after I finished my residency in New York, I practiced in the city for a year. Cool. In Manhattan. I worked at 2 offices, one of them in Chelsea and one of them in Tribeca. I lived in Midtown West and I would take the subway and all the things. So fun. It was so fun. And I still have all my best friends live there still, but he got into his fellowship for hip and knee surgery at Brown University. And so at the time it's a 1-year fellowship. So I was trying to decide, am I going to make a move again? And we hadn't had kids yet. And I thought to myself, is it worth it staying away from him again for another year? And so I happened to actually be at like a dermatology conference, believe it or not. And there's like a big convention center and every single skincare brand out there has their booth set up and you kind of wait in line and chat with the reps and get some products and stuff. And I happened to be in line at I think La Roche-Posay. And I was talking to one of the reps for New York and I was telling her, I'm trying to decide what I'm going to do. My husband matched at Brown and the person in front of me happened to be one of the faculty at Brown. Oh, and her name is Sandy. And I still remember this vividly. She turned around. She's like, your husband's going to be a fellow at Brown. We're recruiting. You should talk to the chairman of BRAR and put in an application and see what happens. And I was like, Brown University? I don't think so. Yeah. And I at first was like, I don't know if I should even give it a try. But then I thought, there's nothing to lose, right? Like, I feel like in life, whenever you think that you're less than, you'll never know until you put yourself out there, right?
So true. So true.
So you got to just take that first step and put yourself out there. So I sent in my CV and I got called for an interview and then there we go. Now we decided to go to Brown.
Amazing.
We lived in Providence for a year. It was a lovely year, actually. Met so many colleagues that I respect highly in the field. I learned so much from them and we continue to have this very amazing relationship where I get to see them when I'm going to the conferences. And I met one of my dear friends who's a cosmetic dermatologist who trained at Harvard and basically did research on a lot of the big lasers when I was at Brown. And she was sort of my next stepping stone into cosmetic dermatology.
Wow. Amazing.
It's been
and it worked out, right? So you guys were there for a year, essentially, you said?
Yeah, we were there for a year. I got pregnant there and
Cute.
I had my son there. And then we basically moved 2 months after.
How did you decide to come back to Fresno? I always like to ask that question because I did the boomerang thing too, where you leave and you come back. It has a way of kind of sucking you back in. But here you are, married, very well educated, brand new baby, and you decide to come back to the Valley. So what led you back?
So I actually didn't think that I would come back when I left. I never really thought I'd come back. But then I thought to myself, you know, through everything, now I have a baby. And so before we had the baby, we were looking for jobs and deciding what our next step was going to be.
Okay.
And I always knew that I wanted to come back to California. It had been 15 years, so it had been a long time. A lot of my friends had moved along, but my parents are still here in the Valley, and I wanted to be closer because I'd spent all this time in my career, but having another human to take care of, I wanted them to have all the experiences that I did, being around family and culture. And I just think that I don't know that I would have been able to do it just being like this isolated
solo. I mean, not solo. You have your
family.
husband and you have a support, right? But it's different.
But it's different. And so I think around that time, I mean, my husband's not from Fresno, so I did have to convince him to move here. You know,
where's he from originally?
He's from Salt Lake City, so it's not too far.
Yeah. And like a bigger metro area to where Fresno's different in that respect, right?
Yeah, Fresno's different. But I said, and so actually Spock was recruiting, and I think, you know, one thing led to another, and he was looking into a job there, and then he was like, I don't know though, it wasn't ever our plan to move to Fresno. Like, let's go on some more interviews. So we kind of, you know, scoped out like LA and the Bay Area. And I think, and then, so we made this decision, hey, like, why not be closer to home? And I think for me, because he's a surgeon, I knew I wanted to be able to carry on a career, but also be the mom that I saw my mom be to me. Like, she didn't work. So, and she helped run my dad's office. She's, you know, accountant by education, and my father had a practice in town, and she was just busy even with that and not having to, you know, see patients. And I was like, and to me, I was like, how would I do it all? And I don't think it's fair to my husband to put a lot of strain on him, because his job requires him to be able to like mentally think clearly. Like, it's just, and I think I knew that because I had seen what my dad went through,
of course,
in life, and how difficult it can be. And I think I made that sort of decision just with this whole like knowing of what I had grown up with over time. And I was like, I think that I just need to make this decision and come back.
Right.
And it. So here
Love
I
it.
am.
Love it. And that was how long ago? About 5 years ago?
Yeah, like 4.5.
Okay. So what was that? I mean, I have a similar situation in that I was gone for, close to 15 years.
Wow.
And then came back, and it's different, right? I mean, what was your experience like in not having been here since high school?
Yeah,
right?
I know it's different. So it took, and I'm sure many who have moved back have probably felt similarly that it takes a minute to adjust. We actually moved right before COVID. Right. So it was 2019. My son was born in May. We moved here in August. And then COVID hit 2020. We started our jobs. All the things were good in that way. I was a new mom with like not many friends. I had actually moved from like New York, or, you know, the Northeast, where a lot of my friends didn't have kids yet.
Yeah,
I didn't even know what it was. A different lifestyle.
Yeah.
And I think that like took me for a little bit of a surprise. I had
well,
a
then
little
you
bit
come
of
to
a
Fresno and everybody has kids at like 25.
Yes. Right.
Not actually, but like
but
kinda.
like early on. And then, so I'm like taking that in now. I'm like, wow, I actually probably started later, but it's very different. Right.
It's all relative, right?
So it took me a minute. Then COVID happened, which made it hard to meet friends. I think a lot of my friends had moved on and they were not in Fresno.
Right.
I think definitely there were probably people who stayed.
Yeah.
That I had gone to, you know, high school, junior high with, and things like that. But I think now it's so nice, like kind of full circle. It's actually interesting. You know, I see people that I went to high school with, their kids are in my kids' class.
Isn't that
and
funny?
It's so funny,
I
and
know.
it's sweet, and you
It is
kind of
sweet.
just come back around. And I think I've loved having that sort of community sense, that community feel, which at first I actually felt a little uncomfortable by, because I lived in New York City. Like, you could literally be a whatever you want, and nobody cares about what you're doing at any given time of the day. You want to like walk around and whatever you want, go for it, because
It's
everyone's
so true, right?
It's so true.
Like, you can fly under the radar in a larger city. You can wear exactly whatever you want to the grocery store, to the pharmacy, whatever, and not run into one person.
Right.
And here you would think that would be the case, but no, it's the exact opposite.
Right.
Don't you think?
Yes.
Like, you run into everybody everywhere.
Everybody all the time,
Yeah.
everywhere. And that for me, I felt initially a little uncomfortable with, especially because I feel like when I was in New York, it's a very like litigious society. So everything is very formal, and, you don't, patients don't know your personal life. You keep a distance with that. And you, like you said, you can fly under the radar. So I think it took me some time to kind of like understand this more community concept, but I love it now.
Yeah. Isn't it great?
It's great.
Yeah.
And you can, and I think like it makes you a little bit more vulnerable, but then it does allow for like people to reach out and give you help. I feel like people are super nice. They are truly genuine about like helping you out when you need it. My neighbor, just from like neighbors, like so lovely. My neighbor literally would, when I was in fellowship here, and I had Anjali, who was not even 1 yet, and my like nanny couldn't come until 8. She would come in the morning for like 2 hours and just be with my baby to let me get to work. And it's just the little gestures that I've truly loved, and so it's made it a really great experience.
So great.
Yeah.
So your husband dove into his career in orthopedics, right here.
Yes.
And then you got into practicing dermatology here as well, right?
Yes. Yeah.
So let's talk through that path.
Yeah. So, I worked at 2 offices and, doing medical dermatology and kind of, cosmetic dermatology, which you do get a decent training in just your basic residency, dermatology residency. But I kind of wanted to take it to the next level. And so slowly, ended up being a fellow with Kathleen Bear and doing a cosmetic dermatologic laser surgery fellowship with her.
Wow, amazing. So what is a fellowship? What does that entail?
Yeah, so fellowship is a 1-year structured program that is typically like accredited by a accrediting body. So for this fellowship, it's accredited by the American Society for Dermatologic Surgery. So what that means, it's not just any old 1 year of training, but it required like rigorous, things that it had to, needed criteria to be able to be a structured program for post-residency training. So what that means is you have to, in order to create this program, you have to have evidence of so many cases being performed of filler, liposuction, resurfacing lasers, so on and so forth, for it to become a program. And that was like a 1-year process to get it approved.
Wow.
And then once it was approved, being a fellow, you do have to fulfill and do a certain number of cases of, XYZ. So fillers, neurotoxin, resurfacing lasers, microneedling, liposuction, all the things, along with presenting and doing research. And so that is sort of what the structured program is. So I think, when you really want to be true to your field and know everything there is to offer, it takes like that time and understanding. And so there's like a curriculum, you have to go to conferences, you have to present. There was a little bit of that involved, which was a really good academic exercise.
I bet.
And it was nice to have the structure, but it was pretty busy.
I bet. Yeah, busy is a good word for it, right?
Yeah.
So now you're in a place with your practice where you're able to practice medical derm and cosmetics, which is, I imagine, fun, challenging. No 2 days are the same, right?
Right. It's just a hodgepodge. My every day is
Yeah.
a mix of everything. It
Yeah.
will go from, doing a full body skin check and diagnosing a skin cancer, seeing a atypical mole that we're unsure is this like a melanoma or benign mole, to treating a patient with acne, to treating like a blistering disease, or a drug rash, which is actually a patient I had yesterday who was having a full on drug rash to an antibiotic, to walking into doing like a filler and Botox and resurfacing
wow.
and liposuction.
Yeah.
It's all over the place.
All over the place.
All over the place.
Wow. And you're just like on it. Like your days are probably long and packed, right? And it's like you just make the most of it. I mean,
You just make the most of it.
Yeah.
It's a lot.
Yeah, I
Sometimes my like brain is just constantly moving because you're thinking through these cases. So there's something about being a dermatologist, right? So we treat all skin disease, so disease of the skin, the hair, and the nails, and that's what our like dogma is. So there's something with that makes you want to have that specificity in your like diagnosis. So
Yeah.
for example, you can have skin disease that's diagnosed by, a primary care doctor or a mid-level provider, but if it's not diagnosed correctly, or if there's something that's going on,
Right.
it's like me that needs to clinch that diagnosis
Yeah.
of something, which every now and then there are these random zebra cases.
Zebra cases. Interesting.
Like
Yeah.
the things that people will be waiting for a diagnosis, and it's like up to us to make that. Or it's, sometimes you can have these pretty benign findings on the skin, but it could mean something else that's going on internally. And that's like up to us to bring that to the attention of the doctor, of the patient. So,
It's an interesting concept too, is like so many things. I mean, we could talk about so many things, but let me start with this. I feel like now with the rise of social media,
yeah.
they're naturally women, men, people of all ages are influenced by what they see on social, right? So like you
Totally.
see these trends of like the tweens and the teens and all of their skincare routines, and how ultimately we've talked about this, like they're unsafe for their skin,
Yeah.
right?
Yeah.
Because you were saying, explain that a little bit further. Like some of the products that they're using, their glands aren't like fully developed, right?
Right. So, I think we classify tween
Yeah.
between, the ages of like 10 and 12, right?
Yeah.
And so that's truly not even pre-adolescent yet, right? So
Yeah.
their skin is still considered baby skin. And so essentially, all of the things that are being displayed with these like 10-step routines on Instagram, social media, that include using like toners that have acids in it, or retinols or peptides,
Yeah.
harsh exfoliants, are just too irritating for baby skin. The beauty of being young is that your cells regenerate so well. They're young cells. And
Right.
so
Isn't that what we're all trying to do at this age, is like build collagen and
100%. Right. And now there's a lot that's coming through with skincare, even looking at how like regenerative medicine, and this is the next future of this 2024, is exosome therapy, but we can touch on that later. But going back to the tween thing, they don't need anything but a good moisturizer, a gentle moisturizer, a gentle cleanser, and then protect your skin from the sun at an early age. So sunscreen. All of these other things that are, we call them alpha hydroxy and beta hydroxy acids, such as glycolic acid, lactic acid, salicylic acid, they can provide benefit, but for older skin. So when we talk about, when you're young, you haven't even started producing oil from your oil glands yet. It really starts to happen as you hit puberty and things like that, then, and which is why you start to break out in acne. And that's where some of those products we may, depending on what their skin type is, start. But like for that young generation, it can actually be somewhat detrimental to their skin. If they started, it can cause chemical burns or irritation.
Right.
We call that contact dermatitis sometimes. And in fact, exposing your skin at such a young age to some of these things can potentially make you more prone to getting contact dermatitis later on. Because your body over time gets a little bit sensitized to these things, which is how we define it. But
right. I just find it interesting how social media obviously has such an influence on so many people, right? Like younger generations in this case, but even women our age.
Right.
And I'm lumping us in the same category. So I think we're about the same age.
Yeah.
Which is like, you know, things like microneedling or the vampire facial or all the peels, all the things. I feel like this is probably a loaded question, but I see these memes on social media, ironically, that say like, if you know what this is, then you should start using retinol. And it's like a throwback from our childhood or something, you know?
Yeah.
So like, let's start there. Retinol, Retin-A.
Right.
Like when should one use that ish? Or, you know?
Yeah.
Like, there's so many things.
There's so many things.
Let's start
there. Okay. So Retin-A is a prescription, retinoid. Okay. And that is typically started when you have acne. So believe it or not, you may end up, someone who has acne starting at the age of 13, they go in to see their dermatologist, right?
Yep, all the things.
Right. So you'll start a retinoid. That helps to control oil glands and helps with cell turnover. And the reason why they found that retinol, which is a derivative of Retin-A, is beneficial for anti-aging and fine lines is because we found that when we treated patients who had acne with retinoids, it helped with acne scarring. It helped with acne scarring because it stimulates collagen remodeling. And collagen is that protein in the skin that makes up the integrity of the skin and gives it that youthful appearance. As you age, your collagen starts to break down, and that's why you get fine lines and wrinkles.
Yeah.
And so that's where retinol came from. So the take is if you have more oily skin or acne prone skin, you probably started using a Retin-A, retinoid of some sort at a younger age. If you can tolerate it and you continue through the course of your life, wonderful. If you were not one of those people and you have more dry skin, you have maybe a history of eczema and you just can't tolerate it, then not to worry. Use it slowly. At some point in time, we'll get you on a retinol. And sometimes that can be in your 20s because why start something that's harsh that you're going to be looking red and flaky? That defeats the purpose of how you want to look, right? So give it some time until you can tolerate it and we build it on slowly. Retin-A and retinol is not going to reverse a lot if you aren't protecting your skin from the beginning. So like wearing a good sunscreen, just protecting, not going out and tanning, seeking shade, all of those things are key earlier on in life.
I also feel like too, we're like making up for what we damaged our skin with
before.
Tanning beds were a thing in high school. And I hate to admit that because I am a walking example of that.
That's
with
okay.
All
there
of
are
my
many
moles and all the things.
Yeah.
But, it's like now. So when it comes to aging for somebody in their, anywhere from your 20s to your 50s plus.
Right.
Like, there's a fine line, no pun intended, where like you want to age gracefully and kind of prevent some of this damage from happening, right?
Right.
But like doing it in a way where it's not overdone. So how do you, capture that?
Yeah, that's a good question. I think that, we find that the pendulum swings back and forth. I think there was a wave probably a few years ago where that overfilled syndrome was starting
like
sort
the
of
duck lip vibe. That was a thing.
It was a thing. Yeah. It was creeping in and the pendulum, I think, has quickly swung back. And the concept behind it is that you don't need to do, as long as you're starting in your like early teens through your early 20s of protecting your skin with your skincare. So again, a good sunscreen. You get on a retinol as you can tolerate it in your early 20s. And then you get on like a vitamin C serum, which there are a couple out there that I feel like have been backed by good like trials to know that it has good efficacy and it works. Vitamin C is an antioxidant. It protects your skin against free radical damage from ultraviolet light, right? So this is like all in the anti-aging kind of field. Category, right? So you start using those. Then as you approach your like late 20s, 30s, it doesn't hurt to maybe dabble in a little bit of Botox preventative and consider some of these lasers that we do as prejuvenation.
I like that. Prejuvenation.
Yes. So it's a term that's been coined as like, slowing down the signs of aging. So doing these little like intervals of mild treatments, whether you decide to do your microneedling or your microneedling with radio frequency or a laser that doesn't, a lighter laser that's not going to be so ablative, but just going to help to resurface the skin. And you do that like over a period of time, you will see how you will not, if you look at pictures of your mom, for example, or your dad, and that genetics are there, you will slow that process down.
I know that's an interesting factor too, right? Is like genetics. Like, ultimately that's part of how we age also too.
Yeah.
I mean, obviously.
Right. And I think that they're doing a lot of, looking into the science behind, we call it like regenerative medicine to understand like what sort of epigenetic fingerprints you have. I mean, it's a big term, but it basically means like what sort of genetic role does it play in aging or like cancer prevention, all these little things that we're kind of looking into now, and how much of that is your environment. So what is the mix and what is the perfect blend, sort of a say. And I would say we know off the bat, for example, in the realm of like skin cancer prevention or aging, that having fair skin, light eyes makes you at an increased risk. Right. And so in that way, we try to make it personal for everyone, like a personal plan of what do you need to do versus, someone with more richly pigmented skin may age in a different way. They may get more dark spots and blemishes and uneven skin tone, dark bumps, so it varies. And that's what we know about genetics. But all to say, we are always making sure that we're catching things like any signs of like skin cancer or anything like that early.
So you can do it all with you.
Oh yeah. I mean, it's like, you have to put it into perspective. But with like the whole aging thing, I'm very much of the looking more natural, I would say. And that's probably a reflection of my training in the Northeast, where I definitely had patients I would treat and they didn't want anybody to know that they've had any medical intervention.
Right.
And I think that concept now is probably spreading through to the West Coast a little bit more because I see it. I think when I initially moved here, I probably was taken a little bit aback about how big people wanted their lips to be. It was like not my thing, my aesthetic. I've always been a little bit more about natural, and I think that's just me personally. That's how I would want to look. So I try to stay true to that. And it's, I love the science, but doing the cosmetic dermatology part is a little bit of my art and creativity. I was gonna say,
you're an artist. I was literally just thinking that because that's what makes you unique, your art, your personal touch to it, your look, with your experience, of course. But I think that's really interesting.
Yeah, it's fun. And I think that like for me, just like an artist, signs their name on a piece of art that they've put their blood, sweat, and tears into, that's how I see my patients. And so I feel like when someone comes to me saying, I need to do this, I need to fill up my cheeks more, do that, I kind of say like, I'm putting my like signature on this. Like, you're sort of a canvas. I want you to look amazing because that makes me feel good about the work I've done.
Right.
And so I think a lot of, finding that perfect provider or that dermatologist that you want to do a lot of these treatments with is knowing, it's a relationship between the doctor and the patient. And you have to have a similar vision, I would say.
Right. And at that point you would say, I don't think you should do that.
Oh, 100%.
I think equally both, right?
Yeah.
Equally saying, yes, I think that's a good idea, but also absolutely
Yes.
not. You don't need fill in your cheeks
Oh,
because you
yeah.
already have strong whatever.
Right.
Right?
Exactly. All the time.
And I
Oh,
do feel like that it can be overwhelming. And I'm speaking from experience, right?
yeah.
Of somebody who's started to dabble in all the things, Botox and whatnot.
Yeah.
And I imagine women my age are similarly, or maybe have for a little while. There's so many people out there that are injectors or are able to, provide some services through med spas and whatnot. And
Right.
for somebody that's overwhelmed and like not sure which route to go, I mean, what would you tell them? What would you suggest for them?
Yeah, I would definitely say, take the time to research. If you're thinking about going to somebody, take some time to research them, get a good understanding of their credentials and how much education they've had in the field. It's one thing to just inject a filler, but it's another thing to know how to treat the complication, because all of these things are not without complications. And when the complications happen, they're real things. Like, you only have one face, right? When you have a scar, the scar is there forever. You can never remove a scar. And so I tell that to my patients all the time. In fact, just yesterday, I convinced a patient not to cut a little cyst out of there. She was younger, probably teenage years, and she was adamant about cutting something out. And I said, if this was me, I would not want to have this. I would not want to, I wouldn't recommend it for my own daughter,
Right.
because once we do something, sometimes those things are irreversible. So I think for someone who's starting to dabble and looking into what can I do, I would start by seeing a doctor who knows sort of and understands the science behind why we're recommending, or who has taken the time to like understand the true data. Like, if someone, and with that, none of these things are cheap.
Right.
There's a lot of things out there.
Right?
It's an
Time,
investment.
money, all the things. Yeah.
Right. And so I think that probably has been one of the biggest things for me, and the reason why I've wanted to become so educated in this field is that I have to, in order for me to feel, I'm not like a salesperson. We go to medical school. I think I was just telling you this earlier. We don't get courses in like business and entrepreneurship. I'm just coming at it from a doctor standpoint.
Right.
So for me, in order to actually recommend something, I have to believe it deep down in my heart to say this will work or this won't work. And so I think having done my fellowship, you learn how to vet the devices. And I think that there is a cohort of like cosmetic dermatologists, probably plastic surgeons, who are trying to be true to that. And so going to meetings, trying to be involved in research, understanding, how do these devices truly work at the level of the skin and underneath the skin is huge for me, because I know how to look at path slides and see where collagen bundles are under the skin. And I think in order to be doing a resurfacing laser, you have to understand how it works.
Didn't even know that was a thing.
You know what I mean?
Right.
And it's, So
I think that's really interesting too, that you're continuing to always educate yourself. I think
100%.
in many industries, I mean, medical especially, I would think that like you're so busy. You are seeing patients all day. You are being pulled in a million directions. And so where do you have time to like learn more and be proactive and develop in those areas? And I'm finding that just in getting to know you and seeing more of your practice, that I feel like you are really you feel passionately about continuing education.
100%.
Which is cool.
I think that like, it's hard. I have like a stack of, so the big like blue journal we call Dermatologic Surgery is the journal that comes out every month with the clinical trials and the white papers that are done on devices. Usually the devices don't say the industry names because it's meant to be like a truly clinical journal. So my goal is to read them every month. When I was in fellowship, we did do that every month. It was called Journal Club. We would discuss patients and cases and, less than optimal outcomes that we would have had with patients, things like that to learn. And I like try to continue that as much as possible. I think you learn the most from your patients. So really taking the time to see and understand how a patient did, how they could have done better. It always is humbling to see that in real time. And I think that's why there's this constant need or want to learn more, because you can always get better. Like it's never done.
Yeah.
So I have a huge stack. I try to read them as much as I can. It's hard. Sometimes I'm falling asleep because it happens after I put the kids to bed.
Yeah. And you're raising 2 young children and have your husband, your family. Like, that's a lot to juggle, obviously.
It's
I mean,
lot.
there's only so much time in the day, right? We were talking about this, like waking up early, going to bed later, prioritizing sleep, all the things.
Right. Which is why, I mean, I feel like I'll be totally honest. Like, I don't do a 1,000,000-step skincare routine. I really don't. Like, I don't have time for
simple,
it.
Yeah.
I keep it simple.
Well, you look amazing. So whatever you're doing is working.
Honestly, I'm one of the people who had acne. So I started using Retin-A from when I was like in 7th grade. And I would say probably in my 20s, I added on the vitamin C. I was using a sunscreen all the time. For me, mainly because so people with more richly pigmented skin, you get post-inflammatory hyperpigmentation from your acne, which can be extremely like challenging to treat and affect a patient. And so I always rule of thumb, you always have to wear sunscreen to make sure that those spots are not getting darker. So have been wearing sunscreen forever in a minute, and then added on the vitamin C in my 20s. And then I've had some treatments, the lasers here. I don't have a lot of time myself to be the patient.
Yeah, right.
So I think I get like little spurts of things here and there when we're like demoing a device, or I have a free moment to get it. But I've had some resurfacing lasers. I've had some microneedling with radio frequency. I've done some microneedling. I've done a little bit of filler and toxin. But I'm very like particular about it because I don't ever want to look overdone. It's your face.
Yeah.
And so I think ultimately you need to live, right? Like the one thing I feel like, and I think because I'm in this field, I hope to remind like the younger generation is just like take us one step to take care of your skin, but live your life, like be healthy, study, do all the things that are going to help you yourself grow, because this whole thing with marketing and social media and Instagram, it's like never ending.
I know.
And
Trust
like,
me, I know.
you know, like with you think about it when you have children, and I have a daughter, and the last thing I would ever want is for her to be looking in the mirror for like hours on end every day, trying to see how she can perfect something. I don't ever want to get to that point. I think that's one of the biggest things because we have children now.
Yeah. Oh, yeah. Huge. Seeing the influence of social media just in general, but also confidence building. I feel like confidence building at any age is vital, right?
Yes.
And raising confident children who will be confident adults.
And leaders.
Exactly.
Right.
And I feel like there is, literally it's called cosmetic dermatology. So obviously there's a cosmetic aspect to what you do, but from conversations that we've had, I feel like a lot of what you're trying to do is build confidence in your patient.
Yes.
So, I mean, yes, all these things are amazing. They make you look more youthful and can contour certain parts of your face or your body or whatever, but ultimately you're just trying to support them in building their confidence and having them feel like they're the most beautiful person, right?
Exactly. Just to live a more like fruitful life, like a happier life. And it can be a slippery slope. So there is something called body dysmorphia where, you know, an already beautiful person will look in the mirror and never see a positive thing about themselves. And we definitely see it all the time. And I really try to, you know, we do our best as doctors to stray away from adding fuel to the fire. It's more to, you know, the goal is we actually spend a lot more time with those patients counseling them that they look great. There's nothing more that we need to do, and there's no other like intervention me doing the extra syringe of filler, you know, they don't need it, right? And so I think just I've tried, you know, in this industry to stay true to that, because again, why are we doing all these things? Right? It's to make ourselves feel better about ourselves and to, again, lead a more confident life. And I think the best thing that I hear in the day from treating the patients that I do, whether it's cosmetic or medical, when they have a rash or something going on, is when they come back and they're like, I'm so happy. I feel like I didn't have the confidence to do this, and now I can do this. And I think that's when I feel like I've done my job.
Amazing. Yeah.
So it's like the best part of it.
Well, and things like, so we talked about liposuction too, and that's an offering that you have in office, which I was like mind blown by the fact that you do it in office and that that's a service that you offer.
Yeah.
But I think in general, liposuction gets a bad rap, right? I think old school thought was that it was essentially like literally changing your body type and changing the makeup of your body. And now with all things weight loss trending when it comes to weight loss drugs and that sort of thing, like I do think lipo gets a bad rap, but I feel like what you're doing in office with some of the more kind of problematic areas, if you will, aren't changing the makeup of their body, right? Like I mean, obviously you can explain this better than I can, but
yeah, exactly. So, you know, the lipo that I'm doing in the office called tumescent liposuction, where you're awake, is really just to target these like stubborn pockets that are difficult with like diet and exercise to lose.
Or like, didn't you say sometimes like genetically, like you're always going to carry your weight in certain areas.
Exactly.
Right.
Like some people in their posterior arm, some people in their chin. So if you know, just look at their like family line, they from a young age have a pocket, we call it a submental pocket in their chin. And no matter how much weight they lose, that stays there. And so I think that, you know, the concept is just to do like it's a small amount, a small area that we're doing, not to change the way you look. So there are, you know, those procedures like called 360 high definition lipo. Not what I'm doing, but that is like a lot of lipoing, contouring, fat transfer, things like that. I honestly don't know when they age, as they age, where the fat will go later, because it's a lot on their body. But when we're doing like little pockets that have been there, and no matter how much weight you lose, you still have like a little pocket in your abdomen. I see a lot of women who are in really great shape and they don't need like a tummy tuck by any means, but they've had kids, they have a little bit of skin laxing, they have a little pocket in their upper and lower abdomen. And those are usually the patients that I'm treating. They have young kids, they got to be out and like driving their kids to school the next day. They can't have a lot of downtime. And that's where, you know, we do this procedure in office. It takes a few hours and they're essentially walking to their car. They assisted. They can't drive home that day, but they're up and doing all the things after, which just makes it a little bit more practical.
Gosh, the advancement of medicine, I feel, is just amazing. Like that's amazing.
It's pretty. It's cool.
You do. I mean, that's a service you offer pretty frequently, right?
Yeah. It's probably one of my most favorite procedures to do. I just did a chin lipo on Friday of a patient who's getting married in a few months, and we treated her on Friday. I saw her yesterday in office for her follow-up, and she already looks like phenomenal. She's so excited, and she's always had a little pocket, and it was a little bit asymmetric. She has a little bit of a bigger pocket on one side of her chin versus the other, and that's just natural asymmetries that we all have. But she really wanted it gone for her wedding, and so she's happy, and so it's just rewarding.
Yeah. Amazing.
Yeah.
Amazing. Okay. So I was just thinking it'd be kind of fun to do a little exercise here.
Yeah.
So the whole idea is like, if nothing else. So in your 20s, if nothing else, you should be what? Like sunscreen. Maybe Retin-A? No?
Yeah. Retinol. Yeah. Retin.
Okay. Where does vitamin C come in? I feel like vitamin C serum is like, I could be wrong. Correct me if I'm wrong. More of a recent thing.
Yes. So
like at what age is vitamin C in your 20s? Or should you wait till later?
So vitamin C can happen in your 20s. So here's the thing with vitamin C. It's not cheap. It's not cheap for a reason.
I'm noticing that. I just started taking it. I'm like, wow.
Yes.
It's like gold in a bottle.
Yeah. It's not cheap for a reason. So, vitamin C we've known is like L-ascorbic acid. We've known for a long time the benefits of it being a antioxidant, right? But in order for any of these like medications to penetrate the skin and do anything, they have to be tested and proven to do what they're intended to do. So vitamin C is coming onto the market in the last, I would say like the last 10 years has been pretty big.
So it's been around. I didn't know that.
It's been around, only a few like companies. But now a lot of these other companies are making like versions of vitamin C. So I think there's a little more access. Initially the studies were for, you have to, so vitamin C by nature is very like photolabile. It doesn't last on the shelf very easily. It also has to be made at like a certain pH in a vehicle that's actually going to penetrate into the skin and then stimulate new collagen bundles. And so because of that, I think it took some time for like it to really come full-fledged onto the market, because I feel like now there are a lot more companies that have figured out how to make it, which is fine. But with that said, I don't know how, like, if all of the companies have tested it to the same degree as like some of them have.
Yeah, fair.
So that's why I feel like, and obviously it's expensive. Not every 20-year-old can commit to paying like $150 every 3 months for like a bottle of vitamin C. So I say like, your 20s, your mid late 20s. If you're considering like getting Botox at some point or going to the next step, then yeah, you want a good foundation.
What's this like baby Botox? That's what I mean. Literally, it kind of is in line with what you're saying, which is, I think if I'm understanding the concept correctly, it's like do a little at a younger age and then progressively, I don't know. Is that how it works?
You know what? I'm a little bit confused about the term myself.
Right.
Because I can't decide if it's a misnomer or there's some truth to it. But baby Botox could mean like starting early.
Right.
And so it's all like, we have to evaluate you. Every patient's different. And so the concept of baby units, it's questionable, because if you happen to have a strong frown in the middle that requires the therapeutic dose that was done in the clinical trials with the FDA clearance for Botox, which is, for example, 20 units, you may need that. But then that takes away from the concept of baby Botox, right? Because if I were to treat you with a sub-therapeutic level, it may not A, do what it's intended to do, and B, not last as long, because we know that's the effect of not doing enough, right?
Right.
So I think the concept of baby Botox is doing enough to the degree where you look natural, not overdoing it to where you look like overly frozen, right?
Yes.
Yeah.
That's a thing.
So I think exactly. And spacing it out to the right interval so that, it carries on its longevity in time. And so that is confusing to answer the question about baby Botox. But I think that the concept is it's okay when you start to see lines becoming a little bit etched in, meaning those angry 11s is what we call it, or some of the lines on the forehead where you're starting to notice it a little bit like creasing in your makeup. I think it's fine to start it because Botox works at the level of the muscle, not in the skin. So someone who comes to me in their like 60s and they want to do Botox and they want all their lines gone on their forehead and around their eyes, we call those the crow's feet. I have to counsel them that, look, it's going to soften the movement, thereby softening or camouflaging the lines a little bit. But your lines are etched in, meaning that they are present at rest when you're not moving because of the years of movement from the muscle, creating the creases in the skin to where now the Botox won't erase the lines. Whereas if you start when you're younger, so that's this prejuvenation concept and like the baby Botox, kind of concept. if you start like in your mid 20s or late 20s and you do a little bit and carry on with time, you will never have those lines become etched in to begin with. Because usually, a patient in their 60s who has had a lot of sun exposure through time and they want to start doing Botox and have done nothing else, and they have a wedding coming up and they want all the lines erased. I have to tell them, like, look, I can't erase the lines. I'll soften the movement, but I do have to do like a resurfacing laser now to, resurface the skin, which is for the skin.
So that's an interesting perspective of like muscle versus skin. Because I feel like obviously when you get Botox, or at least in the few times that I have, I mean, your skin definitely tightens.
Yes.
Or it's perceived that way, right?
Yeah.
But it's also your muscle behind your skin.
Right.
That's what you're saying.
Yes. It's working on the muscle. It's actually working at the neuron, the level of what's signaling your muscle to move.
Interesting.
So it's an interesting concept. But when we're doing your Botox, we have identified and understood the muscle movement so that we can create a look that is perceived to be that your brows are lifted naturally, not too lifted. Your forehead lines have softened, but you can still emote and show some emotion. And you can smile correctly and not flatten out your smile. So those are all the things that we've kind of understood with where the muscle is, how deep the muscles are. So everyone takes a different approach to Botox. I take it very scientifically. I know where the muscle originates, where the tail of it ends, where it is under the level of the skin. We learn this through cadaver anatomy labs and things like that. It's wow. So there's a lot that goes into the Botox just to make it natural.
Yeah. Which, to your point, is why you go to somebody who's certified and educated and all the things.
Right.
Yeah. Interesting. Okay. So if nothing else in your 20s, you're saying moisturizer, sunscreen, Retin-A, maybe vitamin C bleeding into your 30s. 30s, vitamin C.
Yes.
Moist, all the things.
Yes.
All the things. All the same things.
All the things. I mean, there's a place for peptides and growth factors. We can probably wait until you're, later 30s.
I don't even know what that is.
It's, it's basically, creams and skincare that's also helping to stimulate, clearing of old collagen and elastin. The new fad actually is exosome therapy. So it's a little branch of regenerative medicine. I'm actually really excited about it.
Cool.
Because I think it's and they're testing it out not just for cosmetic and anti-aging purposes, but also for therapeutic indications for treating leg wounds and ulcers. It's a branch off of stem cell therapy, which is it's kind of the messenger that signals the regeneration of new cells. But we are learning a lot more. Exosomes can be derived from platelets or fat. So they're looking into a lot of that, which is super exciting.
So cool. All these innovative things, right? And then the goal ultimately as you age is to continue to kind of build collagen. Is that right? Collagen is what we lose when we age in our skin or in our muscle or what?
In your skin.
In your skin.
Yes. So we have 3 layers of the skin. We have the top layer we call the stratum corneum. So to debunk the myth about retinol or Retin-A thinning your skin, it doesn't thin your skin. It makes your stratum corneum a little bit less thick because it's helping to turn over the dead skin cells that are about to come out anyway. We call it the poor man's peel. We don't want to see your skin peeling while you're on it, but it's doing this at a molecular level, at a cell level. But what it's doing is it's helping to stimulate collagen. So collagen is at the level of the dermis. So we have the stratum corneum, we have the epidermis, and then we have the dermis. The dermis is where all our appendages, so the hair follicle, the oil glands, all the things reside, and collagen. And so as we age, the collagen starts to get older and thinner and die off, and that's where your skin starts to look dull, your pores look larger or more apparent. You start to see the vessels come to the surface in patients who have like sun damage and rosacea. So we have vascular lasers that treat that. But all of that is because collagen and elastin start to break down. Elastin is what gives your skin its recoil. So the laxity that we see, things start to fall, that is because we start to lose elastin also. So, we have fillers that are biostimulatory that aren't a true filler, but they are helping to stimulate your body to make new collagen and elastin. So for some of my patients who don't want like a hyaluronic acid plumping filler, we talk about doing like a Sculptra which is polylactic acid, or calcium hydroxyapatite, which is Radius, to actually just stimulate your body to make its own new, collagen and elastin.
Wild.
So it's fun stuff.
All the things.
Yeah.
I mean, keeps you entertained, keeps you educated, like very challenged, I'm sure.
Yeah, it's a lot of fun.
Yeah, really cool.
It's good stuff. And there's I think of throughout my career, I just happened to meet people in different parts of this field that like are so, I would say, inspirational. So I went to a conference or a meeting at with one of the filler companies, and I happened to sit next to a girl who reminded me a lot of myself. She was Indian. We had the same handbag, and she was just sitting there hanging out, and we got to chatting. And she's a dermatologist. She has a little son, or a daughter, and it turns out that she was like, she's a MD PhD at the Mayo Clinic, and she was doing FDA or clinical trials for her exosomes, which are now like everywhere, and we're friends now. Her husband happens to be an orthopedic surgeon too, so we are twins on all levels.
I love it.
So we're really good friends, and we get to exchange like knowledge. She just texted me yesterday and was like, "What are your CO2 laser settings?" And she's doing like clinical trials on her exosomes, which is a big company now. It's called Plated, and she did, and she's been working on this stuff for a long time, and it's just so fun. It's such a fun field, and I learn so much from all of these people all the time, and it's very humbling.
Yeah.
Yeah.
I mean, I even find myself gravitating to social media accounts like yours.
Yeah.
Where, they're educating in a different way. They don't necessarily have to be a patient to do that, but there's a community also, I feel like you've probably met people through that as well.
Yeah.
Or at conferences or,
right. Yeah. I meet people all the time through, I think they like, will start following each other if we post like, people who do liposuction will like identify a little bit because I'll post, and then we get to chatting on Instagram, and then we go to because obviously the field is growing within dermatology. Like if you're a board certified dermatologist, it's a small world. A lot of people know each other. There's always, it's just like that 6 degrees of separation. You'll find out that like, someone did residency with someone else and worked somewhere, because there aren't like honestly a whole lot ratio wise in the nation, so a lot of people know each other, and it makes for a wonderful like networking situation. But then now with social media, it's like even better, because I mean, it is hard with kids to go to every single conference and be at every single thing. You still can stay connected, and then if you've never like met them, you run into them at a conference, you feel like you already know them. That's already happened, right? Like a lot. And I'm like, hey, like we haven't even met in person, but I know
like
you.
I know you.
Yeah. Yeah.
The beauty and the kind of weird part about social media, right? I feel like we've all been there. I had a similar situation where I never had physically met up this person.
Yeah.
But we were friends on Instagram. We had, connected over the years.
Totally.
And it's like, how have we not met in person? This is just like a wild.
But you feel like you know them already.
100%.
So there's so much good to social media.
There is. Yeah.
All
for
those
sure,
things.
For sure.
Like.
So yeah, speaking of your social media, at Skin Doc Sean, at SKINDOCSHAN, correct?
Yes.
On Instagram.
Yes.
And you post all the things, education pieces, before and afters, which are always fun to see, of different types of treatments you do, and just continue to kind of share trending content, right?
Yeah, it's fun. I try to catch some things in real time.
Yeah.
Obviously, there's so much more that I do that I can't post because of confidentiality. But I
Right.
try to at least give a little glimpse into like the day to day. I wanted to I was thinking about it. I got so busy in clinic on Friday, but I wanted to take my Instagram around my office because I had a lipo being set up in one room. We were doing Sculptra on a patient who's a bride, getting married in October with filler in another room. I was seeing medical patients doing the skin check in another room, and it was all happening at one time.
All the things.
All the things,
Yeah.
and laser, consults and things like that. And so, but I didn't get around to it because I was I didn't want to run behind.
Treating patients as you should.
Yeah. So,
but fun, just
fun.
A wild, dynamic day, and then go home to your husband and your two littles who keep you on your toes, right?
Oh yeah, it's the best. I think you get. I'm sure you noticed it too, right? You're so busy at work and you're drained and exhausted, but then you get home, it's another layer of your energy that you didn't realize you had. It just 100%. Happens to come out somehow. You're
it's
okay.
Ready for round two, here we go. Buckle up.
Exactly.
Yeah. Until bedtime. It's the bedtime, bath time, dinner time rush, right?
Yes.
And then we do it all over again.
And you just do it all over again. And then you just roll with the punches. And you just make it work. And I think, I'm sure you can say to all working moms in general who are trying to, run a business and do all the things, advance your career. It's just, you just take it as it comes.
It's a give and take, People always ask, how do you do it all? Can you have it all? It's no. You just kind of got to figure out where your priorities are and what you want your priorities to be, and then build your life around those things.
100%. Yeah.
It's an ebb and flow situation. I feel like there's seasons too. We're kind of both in the thick of it right now with our kids' ages, but I'm sure it'll change. As I've heard, right, from parents with older kids, how things kind of transition. So
right.
We have a lot ahead of us here.
I know, but it's it's definitely nice to have, coming back from the East Coast and meeting so many like-minded individuals who want similar things and want to raise their kids in I don't know, the new Fresno.
Oh, 100%. Yes.
Exciting.
I'm here for it all. Clearly that's one of the reasons why I started this podcast, is because I feel like so many people in Fresno, including yourself, are doing really big things here.
Yeah.
We don't have to go to the Bay. We don't have to go to LA. We don't have to go to New York.
Right.
They're doing big things here in the Valley, and I feel like it's a great place to build a business. It's a great place to raise a family. We can afford to own a home.
Right.
This not simple. It's a luxury to do that, but truly important things and foundations of how we want to raise our kids and build our lives. Fresno's got it.
It's
here
got
for it all.
Yeah. And I almost feel like I talked about the pendulum of filler, but even with, living in cities, I did the city thing. I ran the rat race. I knew I could have done it there if I wanted to. I set myself up for it.
Yep.
But then you think about is it good for your kids? I'm sure
your kids, your health,
right?
Your
it's
lifestyle,
hard.
Your marriage, all the things.
Yeah.
All the things.
Some people make it happen.
Well, and it goes back to priorities, right? Living in a larger metro area like LA or New York, for example. Obviously Fresno is a big city and a big metro area. I don't mean it like that, but just different.
Yeah.
Location, right? With that comes lifestyle. Same. I did the grind. I did the crazy work hours.
Yeah.
I would go to happy hour, then go back to work until midnight. It was just, I don't even miss it one bit. I don't understand. Maybe it's age. Maybe, I don't know. But it's a different lifestyle.
Yeah.
And
if you haven't grown up in it from day one, I have friends that grew up on the Upper East Side. They grew up in New York City, and so that's all they know.
Yeah,
and
truth.
There's nothing wrong with it, and they do it, and they're happy, and that's wonderful. And I think that's probably the reason why we found we were maybe a little bit out of place, because we were doing the things, walking the walk, talking the talk, but there was maybe something missing.
No, you're right.
You know what I mean?
You're so right.
I
And
think-
how special that, like, I mean, my kids won't go to the schools that I went to. I don't think, at least based on our school district and where
Same.
we live now.
Yeah.
But like a lot of my friends' kids do.
I know.
And
That's
now
so-
people our age are teaching them.
Yeah.
You know? So it's just like really cool.
It's cool.
Yeah.
It's so cool. And
Yeah.
I think, for me being here, I mean, it's nice to, it was hard leaving like the mentors I had. Like I had my whole network over there. I think that was one of the hardest things initially, but I have great mentors here now. You know, I did fellowship with Kathleen Bear, wonderful mentor, learned so much. She's a phenomenal cosmetic dermatologic surgeon, laser surgeon. So it's been lovely to have that connection also, and just kind of grow with that and just kind of, see what all the opportunities are.
I know. I mean, she's another example of doing big things in the Valley too. I feel like there's a lot happening, a lot of positive energy, a lot of growth, and I'm just grateful that you came back. So thank you.
Yeah, no, this
thank
is awesome.
Thank you for being here. Thank you for sharing your story and truly bringing your talent, your expertise to the Valley, because I know you're going to do big things and are already doing big things. So
thanks, Ray. Thanks. It's been a pleasure to be on the show and getting to know you. I just can't wait to see what we look like when we're 60.
Well, thanks to you, we're going to be looking real good.
Yeah.
Thanks for listening. Feel free to rate and review this episode here and connect with us on Instagram if you have any thoughts, questions, or any guest suggestions. Thanks.